Well, hello class, and welcome to Module 7. So this module is all about respiratory, and it's such an important module. So why does it seem that young children, like toddlers, always seem, especially in the winter months, to have a constant drippy nose, cough, ear infections? Why does that happen? Well, a lot of reasons. Number one, kids have tiny little airways, right? So their airways are about as big as their pinky. And so when they get a cold, they get all this congestion and fluid, and it's hard for them to mobilize that. It gets stuck in their tiny little airways. Two, a lot of kids are in daycare settings, so they're in crowded settings. And then a lot of these viruses are new to them. They've never had these viruses before, so their body needs to experience them so they can develop immunity, so they will learn how to fight them off. Also, kids are not good about covering their cough. We teach them to do this. They're not good about that, so they spread it everywhere. And young children also like to put things in their mouths. That's the way they learn about their environment, but that's a good thing, but then they also get all the germs that are on top of those toys. So there's lots of different reasons why children always seem to have a lot of respiratory issues, again, especially in the winter months. So it's not unusual that children have about 6 to 10 colds a year, and most of them happen over the winter months. So it seems like they're constantly sick when they're little, and this is okay. There's other respiratory issues that can happen just after they have, say, the common cold, an upper respiratory infection. If the congestion in their nose drains down through their eustachian tube because it's so short to their ear, then they can get a middle ear infection or otitis media. The mucus can drain down their throat. They can get a sore throat. The germs can go to the lower respiratory tract and it can become pneumonia. So there's also other complications that we need to think about in caring for pediatric patients with respiratory illnesses. Also, we will be learning about and thinking about wheezing and bronchiolitis. Wheezing causes a squeaking sound, usually with when the child breathes. So it's like a he kind of a sound. It's a wheeze. And there's croup, which is another virus, which causes a barky kind of a cough, kind of a sounds like a or a seal, and has inspiratory stridor that happens with that, so it sounds like a gasping sound. That's because the vocal cords are inflamed. Also, we think about other severe infections that needs emergency care, like epiglottitis. Also, children have cystic fibrosis, which is a disruption in the normal function of the epithelial cells, which can affect, those make up the sweat glands, which are in the skin and line the passageways in the lungs. So kids with cystic fibrosis have a lot of difficulty with their respiratory system. It also affects their pancreas, their digestive and reproductive systems. So 30,000 people in the United States have cystic fibrosis, so we'll be learning a little bit more about caring for those children. Asthma is the leading chronic illness among children and adolescents in the United States. It's also the leading cause of why children are absent from school. So it is the nurse's responsibility to make sure that the children and their caregivers, their family members, their parents understand how to care for these children, how to avoid their triggers, because children with asthma may come in contact with pets that are triggers. If they get a upper respiratory tract infection, that can be a common trigger. Change in seasons can be a common trigger. Dust mites, cockroaches. There's all sorts of triggers. So nurses really need to do good teaching and assessment to find out what it is that is triggering these patients' asthma, and then help them to develop an asthma treatment plan, and we'll review some of those. So pediatric nurses spend a lot of time helping kids and their families with respiratory conditions. So it is up to the pediatric nurse to assess for respiratory distress in children, because they can decompensate or poop out pretty quickly. So we need to look for those little signs, like are they retracting right there, or in their rib cage you can see the ribs, they're retracting. Are they sucking in? Are they nasal flaring when they're breathing? Are their lips turning blue? That would be a little bit later of a sign. So helping parents recognize these signs of respiratory distress and when they need to call 911 or take the child to urgent care or call their provider. And then helping them to develop that plan of care to keep them out of the hospital. We don't want kids needing to be hospitalized for these things that we can prevent, and what medications they need to give and when. So it's an action-packed module. Hope you enjoy it. Bye-bye.